me again. I have a little update. Small one, not a good update. As I had mentioned in the last video, I had to call my insurance company to find out if they would allow me to see a nurse for my 6-month medicated or medically supervised diet. Yeah. I called them today and I had 2 questions for them. Well, no, I had 3. Sorry, I had 3. Number 1 was whether they would accept a nurse doing my medically supervised diet. The second is I have a form from my insurance, or not my insurance, my surgeon, that I have to fill out that says I have to call my insurance company myself and get some information from them. And, I mean, this form has questions like who my insurance carrier is, the phone number I called, the day that I called, who I spoke to, their direct number and or their extension number, and a couple questions, yes, no questions, about the requirements that they have. Well, the lady that I talked to was named Ashley, and let me tell you, Ashley was not helpful. The only thing that I could get out of her was, I cannot tell you that information, you need to have your doctor call. We do not give that information to clients. Yeah. So then I turned around and I was going to call this lady that works with my surgeon. She is the insurance specialist, which she knows, like, she helps communicate with the insurance companies and advocate for the patients and stuff like that. Well, she is out of the office until tomorrow, so I'll call her tomorrow. My other question that I had for my insurance company, I am in this program called a lock-in program, which means that I have one specific provider that I can see, one specific pharmacy, one specific hospital unless I'm referred out, one specific emergency room that I can go to, and anything else has to get pre-authorized or prior authorization or something, which that's a really big pain in the butt. There's, I think they said 11 providers in my clinic, and I can only see one. And the one that I happen to be locked in to see happens to be the busiest doctor. So I call for an appointment, and it's scheduled 2 to 3 months out. Unless I'm, sick, or like really needing to see a doctor, I'm really sick, then they'll put me with a different doctor, which then my insurance grumbles about it. And so I called them to ask them if there was any way that I could get all of the doctors at my clinic in my lock-in program, which I had been told before that I could, but the whole clinic as a whole has to have its own NPI number, which is a National Provider something. They have to register an NPI number. Well, the way my clinic was set up, I thought was that each doctor themselves had their own NPI number, which that's what the insurance was saying, that they couldn't lock them all the separate NPI numbers. They can only do one. Well, my mother works for the hospital, and I found out that the clinic as altogether has one NPI number as well as each doctor having their own. So I called the lock-in section of my insurance, and the lady I spoke to, I have no idea what her name is, she wouldn't give me her name, and she didn't want to tell me any information. She told me I was flat out wrong, and didn't want to explain anything, didn't want to tell me how I needed to do things, and was very irritated that I was asking questions. Which, yeah, that frustrated me a lot. And I walked away with no answer, other than I have to call my clinic and have them request to have my NPI provider changed. Who knows? Maybe I'll call back tomorrow and talk to someone else. Because like I told you, a couple weeks ago when I talked to someone about it, they told me that I could lock in my whole clinic, it's just they had to have one single NPI number. So now I find out they do. and they're telling me they can't do it. Oh well. We'll figure it out. Hopefully. Maybe. Other than that update, I've been doing a little bit of changing with my channel. I mean, you guys will have to tell me if you like the changes. The big one that I have made an intro video, which you saw at the beginning of this video, and I'm having fun with that kind of thing. I mean, I found a couple different ones that I've been playing around with, so they might change. You might have a new one next time. We'll see. I still haven't heard from the surgeon's office as far as the referral that my doctor sent in, or the nurse, like health coach that my doctor referred me to. So, I don't know. I've done good. I haven't had any pop at all this weekend. In fact, I have Crystal Light in my Starbucks cup, and it's delicious. I'm actually running out of Crystal Light. Shocked. So I have to go and buy some more. I think Walmart has it on sale right now for like $1.25 per package. And each package comes with like 6 different things. So that's where I'm at today. Hopefully I will have another update for you soon. Bye!